Welcome to A Journey to Whole Woman Health, the podcast where science, mental health, and faith come together to educate, empower, and encourage women in every season of life. We're your hosts, Dr. Jamie Irwin, board-certified OBGYN, and Dr. Mary Catherine Nader, licensed professional counselor with a PhD in counseling. Let's begin the journey.
One of the most common things women tell us is, I know I need help, but I don't even know where to start or who to trust.
As a result, so many women stay with providers who don't listen, who minimize their symptoms, or make them feel like they're asking too much.
Today we want to give you clarity, confidence, and permission to build a care team that actually supports you.
Today we're all about choosing your care team, mental health, and women's health. Let's get started. All right, Mary Catherine, Dr. Nader, for those who are just joining us, perhaps this is their first episode, definitely go back and listen to our episode number 1. Tell us about your background. Tell us about these letters behind your name.
So I have my master's in pastoral counseling, which is a combination of theology and mental health that I got at Asbury Seminary. And then I received my PhD in counselor education and supervision, which is the PhD that's certified by CACREP, which is the certification agency for licensed professional counselors. And then LPC is licensed professional counselor. And I am licensed in the state of Texas. I'm actually a supervisor now, which is an additional license. So there's so many different kinds of licensure for therapists, and I think a lot of times women and everyone get confused on what those different titles are. Mm-hmm. So we can kind of explore that a little bit more today. But the biggest thing is just finding somebody who's the right fit for you, who you really feel like you connect with and feel comfortable with. And I always tell my clients that on our first session, like that's the goal here, is to make sure you find somebody that's a good fit for you. And I always tell them, my number one goal is that you get the help you're looking for. And if that's not me, that's okay. Like my number one goal is that you find the help. So I'm always happy to give referrals. I'm always happy to connect them with someone else who specializes in what they're needing, because I want them to feel better.
Yeah. So I imagine there's a lot of women listening that are wondering, do I need therapy? How do I know? And then that next question is, how do I find somebody? Sure. So that's what we're talking about today. And then we're also going to talk about that as far as an OBGYN.
Yes.
So we're really excited to share this information. It's important. It matters. And let's get started.
Interview each other. Yeah.
Yeah, for sure. So let's get started, Mary Catherine. When might therapy be helpful?
So I am biased, and I think that everyone should have a therapist. I feel like therapy should be like going to the dentist or going to an OB-GYN if you're a woman, or having a PCP. I feel like the best time to find a therapist is when you're not in crisis, when you actually are not needing a therapist, because then you're able to really go and take your time and find who you feel like is a good fit for you. Kind of like going to the dentist just for a regular cleaning, or going to the OB-GYN just to get checked out. You know, you don't want to go to the dentist the first time when you're having a horrible pain and a root canal and you don't even know this person, they don't have any of your records. Or go to the OB-GYN the first time when you are having the baby and they don't know anything about you or your health. I mean, that's not a great experience for the physician. It's not a great experience for the patient either. So I always think it's a great idea to start when you really don't even know if you need somebody, because then you are able to find that connection, so that when, and I don't say if, I say when, that grief comes, or that trauma comes, or just the stress of life comes, you already have a person that knows you and that you've connected with, that you can reach out and schedule some sessions with.
I love that. I love that analogy as well. When you put it that way, it really does make sense. And it's interesting that we just have a different perspective when it comes to mental health. We're not doing that maintenance. Most of us are not, right? We don't have that relationship established. We don't have that provider in our tool belt.
I think it should be like going to the dentist. Again, I really think everyone should go like at least twice a year. Just check in. here's what's going on in my life. It's kind of like just getting checked for cavities. You might not even know something starting to form there, but a person who's a professional can kind of point it out, kind of mention, help you work through it before it becomes a big ordeal. And then if there is something significant going on, again, you have someone to help walk you through that.
I love that. And therapists are willing to do that, kind of have like a once a year, twice a year?
I am, for sure.
Yeah.
I know most therapists, I can't speak for all therapists, but I would assume that for us, it's like when we first meet somebody when they're in crisis, it's like an OB-GYN first meeting somebody when the baby is coming out. We don't know what their normal is. We don't know, what are these symptoms? They're normal. What's their, baseline?
Yeah.
And so when you're able to kind of form that relationship with a person and have that established relationship, it can be so helpful, because then when those things come up, you kind of already know their norm and what their coping skills are, what their relationship with their family is like, that kind of thing.
That is so true. I love that. Now, for those of us, perhaps, maybe we are experiencing some signs that we need to find a therapist. Maybe we're not quite in crisis. Maybe we are in crisis. But regardless, whether we're looking for this person to just have a maintenance mental health check-in, or really kind of move past some issues of mental health, or perhaps we're in crisis, what are some signs, besides the daily maintenance, what are some signs that I need some help?
Sure. I think there can be so many. Obviously, stress can show up in so many different ways. We can be having trouble sleeping. That's a huge sign. Flashbacks are a huge sign of trauma. Some sort of emotional, physical response to things in the environment can often show that there's some trauma that needs to be worked through. Also, anytime anxiety seems to really be feeling out of control, that's a really great time to go to therapy. Depression, symptoms such as having a hard time getting out of bed, not feeling motivated, just easily feeling overwhelmed, feeling like you are a burden to people. Those can all be signs of just feeling depressed and overwhelmed, not really wanting to care for yourself or others. Anytime there's a major life change, whether it's a divorce or some sort of a relationship change, job or career changes, motherhood, becoming a mom, I think that's always a huge change. As we've talked about, I had postpartum depression. I feel like everybody should have a therapist when they get pregnant, because it is such a huge change. It really is. Your identity is changing. Relationships are changing. Your schedule is changing. There's not really anything. Your body is changing. Everything's changing. So I think it's so important to have somebody who can just continue to walk through those changes with you. So those are just a few of the times. Obviously, any sort of grief, a death, that can be a huge time just to have someone to help process things that maybe you don't feel comfortable saying to anyone else. Yeah. But you just need a space to talk about stuff, knowing that it's going to stay right there in that room. You don't feel like you're overwhelming or burdening anyone else, or you're having to filter yourself of what you're saying. You have just a safe space that you can talk about things and sort through them.
Would you be willing to share your story about postpartum depression?
Sure. Yeah, so let's see. It was with my second. We had just moved. Lydia was 2 or almost 2, so it was just, they were very close together. My husband, Joseph, was starting a new job. He was really busy. Just lots of transitions at once. Didn't have a big social network yet because we had moved. I wasn't working at the time because we just moved. So there's just so many different things. And looking back, it's like, oh yeah, all the things that can lead to postpartum depression were there situationally. And for me, it was just feeling overwhelmed, the thing that really made me realize I needed help was I had the thought of everyone would be better off without me. And in my mind, I knew that shouldn't make sense, but somehow it did, and I couldn't reason it away. I wasn't thinking, here's how I would end my life or anything like that. I just had that one thought, and it was like I could go through and think of how different people in my life would somehow, and I couldn't tell you now, but at the time I was. And I remember thinking, this isn't right. This shouldn't be making sense. And so that's when I started going to therapy. It wasn't a person who specialized in postpartum. It was actually a man. He was great, but he is actually the one who encouraged me to pursue, because I already had my master's, to pursue specializing in women's mental health. But that was probably, it was almost like a red flag, like in the old school inboxes of our email, like Yahoo, where you put a red flag, like, no, this shouldn't work. This should not make sense. And it does, and I can't reason it away.
Yeah.
So I think I have a real compassion for people because I know how scary that is. I think that those thoughts can be really scary for people. And even intrusive thoughts, they're so common with new moms, thoughts, that they think they're really going crazy about, their hormones are just totally out of whack. They're exhausted and they're having, thoughts about, all kinds of things. And so, to provide a space to just kind of work through those things, especially if they're scaring them, that means that something's wrong.
Yeah.
And so to be able to process through it and actually to normalize it, like it's so normal to have those kind of thoughts because your brain is just really out of whack and your sleep cycle is totally off. So to normalize it and say, hey, there is help, there's medication we can take, which I did take medication, which was so helpful. Therapy, those two things together really, really, really can make a difference and help people feel better because you don't want to feel that way. It's a miserable way to feel.
So in that moment, you're recognizing you're having these thoughts, that feeling people, family, the baby, your daughter.
I was still breastfeeding at the time. Like it was just like, this doesn't make sense at all. Yeah.
That they would all be better off without you. What was your next step? Who did you tell first? Who did you reach out to? How did you get help?
I remember because I was lying in bed because I remember the picture next to me was of my kids and just thinking like, how could they be better? Like, this doesn't make sense. And so I remember telling my husband, Joseph, who of course was immediately concerned. I wasn't like, I'm suicidal, but I was like, I had this thought, which is scary. Yeah. And then I reached out. I had a therapist that I had already met with before. So that, again, is a good reason to have one. So I was able to go talk with him and again, ask him. He didn't know of anybody who specialized in it, but he was able to help me work through it. And again, showed me the reason that there is a need for this. But that's what I did first, and it was really helpful. And I think that's the other thing, too, normalizing these things so that women are not afraid to speak up. Because a lot of times when we have these thoughts or experiences, we're so afraid to talk about it because we think people are going to think we're crazy or they're going to, like, take the baby or lock us away. We just need to be able to talk about it so that we can get better and get the help that we need.
Yes.
And I know, like, OB-GYNs now ask these kinds of questions. I know you do.
Definitely.
And it's so helpful because it just normalizes it,
Absolutely. Absolutely. Well, good. Well, I mean, what an impactful part of your journey that you went through that, you came through that, and it really molded
for sure
your career.
Yeah.
And, for those who may not know, Dr. Nader specializes in women's mental health, and that is so rare to find someone. And I know when you started, you had some fear, like, will this be enough?
Yeah.
Is it enough? Are you busy enough?
Oh yeah, for sure.
Are we keeping you busy?
Yes, for sure. I love it. And that's the other thing. I love it. I love helping women. Like, it's just such a fun and meaningful place to be. And so I'm just so grateful to get to do it. And when you've been in that before, what a meaningful thing it is to be the person to help someone. So.
And it's so much more than just postpartum depression,
right?
Oh, sure.
Yes, definitely.
Tell us more about what you see in your practice.
So I do a lot of trauma counseling. I'm certified in EMDR, which is a trauma processing, and it's amazing. It really is incredible. I can't obviously guarantee anything, but it's just so amazing to watch how people are able to process through some really difficult, traumatic things that they've experienced in their life. I do a lot of grief therapy. I previously worked at a nonprofit that was the Warm Place that does grief support. So that was really great, giving me that foundation, because so many things in life are grief. I mean, I think in some ways motherhood, becoming a mom, it's such a change. And in some ways there's some grief involved there, because you're just kind of losing not a part of yourself, but you're just starting a new chapter, a new part of that journey. And there's just a change, and so, but then of course, grief of infertility, of miscarriage, so many of those things that I see that goes together a lot of times with trauma. So, and then of course, just anxiety, but anxiety is a big one. Stress, depression, all those kinds of relationship issues, I'm able to work through with women. A lot of women like to talk about sex issues, which I know they talk to you about as well.
Yes.
Which they all affect one another, right? Everything goes together.
It's so incredible, the overlap of therapy meets gynecology. I really wasn't fully anticipating that when I became an OBGYN, but it's true. There's just no denying it.
Yes, you're like their first therapist for sure.
Yes. And thankfully I have you in my life to teach me and guide me, and also to refer my patients to, because there definitely comes an end to my expertise where I really need you to take over. Because
and same,
of your
where
training.
I'm like sending them like, hey, listen, I can't prescribe medication and I can't check you out down there, but I do have a friend who can.
Yes, we help each other out. That's for sure. Tell us more about all the credentials. Which ones matter? What do all these letters mean?
Yes.
It can get confusing.
Sure.
PhD, PsyD, LPC, LMFT, EMDR, you mentioned that. What do all these letters mean?
Yes. So you want to look for someone who's licensed, first of all. There's multiple different licensures.
Yeah.
So for mine is a licensed professional counselor. So that means you've gone through and completed your master's program. You've taken the national counseling exam. In Texas, it's 3,000 hours of internship hours. And then you become fully licensed.
And those hours are with patients?
3,000 hours. I don't want to misspeak. I think it's half with clients and half of like behind the scenes. But I could be getting that wrong. So it could have changed since I did this. It's been
always
changing. A little while. Yes, but it involves both. And then there's licensed marriage and family therapists, which is very similar, but a different focus of marriage and family therapy typically. And then there's licensed social workers, licensed clinical social workers. So they've also gotten their master's in social work and then done their hours and become licensed as a social worker. And then there's, in all of those, when you're getting your hours, you're considered an associate for LPCs. I'm not sure what the others, I believe they're also called associates, but basically it means they're working on their hours to be fully licensed. So it doesn't mean that they're not helpful. It just means they might not be as experienced yet, but that doesn't mean, they won't be able to help. And then the PhD is depends on which area. There's a psychology PhD, and then there's the PsyD, and then there's the PhD, which I have, which is in counselor education and supervision. So each just kind of have a different specialization, but we can all do very similar things. Psychology, a person with their PhD in psychology is typically going to be able to do more of the testing and assessments, which are sometimes needed. And then the faith-based versus, faith-informed, it really just depends on how that therapist identifies themselves. You can ask them questions about how their faith interacts with it, and everyone's probably going to give you a little bit of a different answer, and that just is helpful to know how they see those two connecting.
Nice. So the letters definitely matter.
Sure.
But it's definitely the fit matters more.
Oh, of course. The fit matters more. And I always tell people, like I said, you want to find somebody that you feel comfortable with, because that's going to make the biggest difference. It's like finding a hairdresser or an OB-GYN or anybody else. Like, you want somebody that you're really comfortable and connected with.
So is it okay to shop around?
I think it's okay I encourage people if I'm not the right fit. And I honestly, in the first session, tell them that, like, also, I'm looking to see if I'm a good fit for you.
Got it.
Sometimes I can see that, what you're needing, I'm not really an expert in, but I know somebody who is, and I'm happy to refer. So you really do want to make sure that they're a good fit for
Got it.
you.
And for what you're experiencing.
And for what you're experiencing. And I always tell people, the more honest you can be with me, the better. So if you're looking for something else, or if you don't find this helpful, I want them to tell me. So I always say in our first session, how would you know that therapy is helpful for you? What changes would you see? What would you actually notice that would be different? Because that helps me to know what we're trying to measure here and what we're trying to work towards. I like to set goals, and that helps them as well. Like, what helps them to clarify, what am I really looking for?
I love that. Very goal-oriented.
Yeah.
So I've definitely decided I'm ready to look for a therapist. What do I do next? So give me a practical checklist here. Kind of, what do I look for? What questions do I ask?
Sure. So it depends. If you're needing to use your insurance, you can go through your insurance agency first to see, like, people who are in network with you. For some people, that's a big priority. Other people, they're okay paying private pay or out of pocket. So then it's a little bit easier in some ways. But good places to ask are your OB-GYN or your pastor sometimes might have referrals for you.
Okay.
Your PCP might have referrals for you. You can also look online, searching through psychologytoday.com. You can filter it by what you're looking for topic-wise, like anxiety. You can even put your insurance in there, zip code, so it can give you kind of some little bios on different people. Now, people are paying to be on there, so it's not going to give every single therapist, but it is a good way to just kind of look through. And then also, it's always great if you have a friend that's going to therapy and they have had a good experience, to ask them. So just kind of looking through your network. Now that it's such a possibility to use virtual counseling, it gives us a broader span. So I see a few clients that are located all over Texas, that I've never met in person. But you're able to do that. And some people actually prefer it because they feel a little more privacy. They're not going to an office. They're able to do it online, from home. So that's also an option.
Yeah.
Is just looking, in the state that you live for people who are licensed there. We do have to stick to where we're licensed, obviously.
Well, and I've seen some ads for some online platforms. Tell me more about those.
So there's different perspectives on those, but again, it's the fit. It really is the fit. So who you're matched with, if you feel like that person is a good fit and that person is helpful for you, then great. If you don't have a great experience with that person, then keep looking. I do say it's helpful to give it a shot, really be honest with that therapist about, hey, I'm really looking for more. I really like homework. I really want you to give me some homework. Or I really don't want to talk about that. I really want to focus on this. And that can be helpful because, again, we can't read your mind and we really are wanting to help. So the more honest you can be about what's helpful for you, I always tell people, the better. Like, you're not going to hurt my feelings.
Yeah.
If this isn't helpful, just tell me. Don't be like, okay, sure, I'll try that homework, when in your mind you're like, I don't have time for that. I'm not doing that. Just tell me, I don't have time for that. Okay, great. Let's move on. Let's do something different. Because there's lots of things, but everybody's different.
I love that.
Yeah.
That open, honest communication.
Sure.
For sure.
Yeah.
Well, I can tell you just briefly my experience with therapy.
Sure.
Thanks to your encouragement.
Yes.
Truly. So I think, like many, I first sought out therapy in crisis. Just really going through a hard time professionally.
Yeah.
And I won't go into those details, but in my job, things don't always go well.
Yeah.
And there's not always good outcomes. So I'll leave it at that. But really just was in a dark place.
Yeah.
And feeling a lot of shame, a lot of guilt, a lot of just questioning. I was pregnant with our son Henry at the time. And I think that definitely added a whole nother layer of...
It was hard. I remember. It was so hard.
Of just difficulty, right? Just my hormones and and the stress of, working while pregnant. That's
Right. It's
a
hard.
whole nother level.
Yes, especially in your field. I mean,
Yeah.
it's all the things coming together.
For sure. So it's really, truly been amazing. And I'm really proud of myself for the growth,
Yes.
for making that a priority. And I'm with you. I wish everybody in the whole wide world would be in therapy. I wish that was available. I know, obviously, there's barriers and financial barriers and access and time and life. But our caregivers, like doctors,
Oh, yes, for sure.
like nurses,
Nurses.
like emergency responders,
Yes. Teachers.
teachers, therapists, yourselves,
Yes.
parents. I mean, the list goes on, but those of us who are taking care of other people,
Yeah.
I think it is so important that we make our mental health a priority.
Oh, for sure. And it's not selfish. I always
No.
tell people, I have so many caregivers that are clients, and I love it because I love helping the helpers. I love helping people that then turn around and help, because I feel like I'm helping so many people
It
by helping that
multiplies.
person. It multiplies. And it really, I mean, it gives me goosebumps because it really is like, it's so important, and that we model that for other people, like being able to share, that we're in therapy, like that says it's okay. And it tells
Yes.
your patients and clients it's okay.
Totally.
And it's not selfish, because by caring for ourselves, we are able to care for other people.
Yes.
That's what allows us to do it. So it's like putting your own, I mean, it's used so much, but oxygen mask on first. I mean, you really, if you aren't breathing, if you aren't healthy and alive, you can't do your job.
Exactly.
You can't do it.
Yep.
So it's so important to take that time to care for yourself in order to be able to
Yeah.
help people.
And we can't pour from an empty cup.
No.
Same idea.
Yes.
What do you think keeps women from seeking help? What are some barriers?
Oh, I think there's so many. I think you named them. I think a lot of times it's the finances.
Yeah.
It's so interesting because I see women often, they will spend whatever they need to spend, private pay, whatever, for their kids, for therapy or for any sort of help. But for themselves, they're very hesitant. And I think it's that sort of selfish feeling, or it's that, and it's hard to work through that. I think it's also just the scheduling of the time, which is why I think telehealth is really great for women, for moms, because they can have a session while kiddos are in the other room. I mean, I can't tell you how many minivan sessions where they're literally just in their driveway, but the kids are inside and they've got good Wi-Fi, or they're in the closet. There's the dirty clothes over here. The kids are knocking on their like I'll be out, especially during COVID, of course.
Oh my gosh, yeah. Bless
But just having that space where but it's so great because it also models for your kids, hey, this is how we take care of ourselves. It's like your kids seeing you go to the dentist.
Yeah.
Again, back to that metaphor, like this is what we do when we need to work. This is how we stay healthy and
this
how
is
we
normal.
work through things. This is normal.
This is not a stigma.
Yes.
This is normal. I think that is so true. And I'm grateful for that and for your encouragement and for my own therapy journey.
I'm so proud of you for doing it.
Because then my daughter also really had a very difficult time, probably kindergarten, first grade, with some very intense anxiety, debilitating anxiety. And so because I was in a good place and keeping myself healthy, I knew what she needed. I was able to recognize it and recognize, ooh, I'm
out of my league. Yeah.
I'm out of my league as a mom. I'm not a pediatrician.
Right.
I'm not a therapist. I need help.
Yes.
My daughter needs help. And we're able to really get her the help she needed with a child therapist.
And she sees it as normal because she knows you. So it's not
Exactly.
like there's something wrong with me. What's wrong with me? It's like, no, this is what we do.
This is what we do. And I really am just so grateful for that.
Yeah.
And now she's 15 and flew to Florida for a
Doing
field
great.
hockey tournament with her team. No mom and dad.
Yeah.
And no big deal. She's
Yeah.
a boss.
She's amazing.
She's so great. So therapy works is my point. What about some red flags?
So I think anybody who's dismissive of what you're experiencing, For example, I went to a different therapist. My other therapist retired. I went to when I was experiencing what I didn't know at the time, but was really difficult compassion fatigue during COVID, being a caregiver. And I went to a therapist and I described, just witnessing other people's suffering, how difficult it was. I was actually working on the traumatic brain injury unit at Children's Hospital. And it was, it was just all the things at once. And it was so difficult. And this therapist was just dismissive. Like I remember saying suffering and her saying, well, surely they're not suffering. And I just was like, they are. They have just been in a horrible car wreck or had a gunshot wound or they were paralyzed just horrible things. And I'm helping them walk through this and I'm helping their families walk through this. This is really difficult. And they're having to have one parent at bedside because it's COVID. It was just like worst case scenario.
Right.
And so anybody, I just felt very dismissed and misunderstood. So that would be a red flag, sort of minimizing, or I don't like to be the expert with there's people might prefer that differently, but just personally, I like to be like, I'm coming alongside you. I'm on your team. You're the expert of what's going on in your life. I'm seeing you maybe 1 hour once a week.
Right.
You're in your life all the time.
Right.
So, I'm here to help and help you hear yourself. And I've got a tool belt of all kinds of things that have been helpful for other people, but if it's helpful for you or not. And I need that, so somebody who just is prescriptive, although some people might want that, some people might be looking for that. So just kind of being clear for yourself, what am I looking for? And then also just talking about what are you looking for? Asking that, what are the goals here? Some people, they literally just want a place to process and talk through things, and that's great. That's okay. It's helpful though to clarify for yourself, what am I wanting to get out of this? What am I really looking for here?
Any other red flags?
Any other red flags? Obviously, confidentiality is a big thing. I always go over with my clients, the most important thing is that they feel safe in this space to share. So I always tell them, I'm not being rude, but if I see you outside of this room, I will act like I don't know you. I've even been introduced to clients in a social setting before and been like, hi, nice to meet you. Like, I literally don't know them. And if they do say, if they are the ones to say, oh, this is my therapist, which I've also had happen at a restaurant with their friends or at HEB, hey, y'all, this is my therapist. Y'all should go to her. Y'all should meet her. We would still not talk about anything that had been discussed in the therapy room. So really just giving them that safe space to share.
So critical. It's like you're undercover.
Yeah. Huh? It's like, hey.
In the wild.
Yes.
My therapist in the wild.
You never know.
So for a lady who has scheduled this first visit, she's going to meet this therapist for the first time. Any other questions that should be asked during that first session just to kind of establish expectations, the rapport? What do you think?
I think asking about how therapy works, if you're not experienced with going to a therapist, I always like to ask people that. Have you been to therapy before? Have you not? What was helpful in the past if you have? What was not helpful in the past if you haven't? I always ask that. Or if you have as well, what wasn't helpful before? But just giving space for that, giving you as the client just the ability to share and not feeling dismissed or rushed or unseen. I think so many women feel that way in life, and this should be a place where you feel like you can really process and deal with stuff that maybe you even dismissed in yourself. Maybe you haven't even really recognized how much something's bothering you.
Wow.
And this is a place where you can actually, I like to think of it as like pulling it out, looking at it like, hey, what is this thing? Like, let's turn it around. Like, let's externalize it a little bit. How is this affecting me? How is this affecting my job, my relationships, my self-worth, my parenting, that kind of stuff.
Absolutely.
And how would my life be different if I really dealt with this?
So good. What are some misconceptions about therapy?
Well, it's not a fix-all, you know. I always tell clients it's almost like going to the gym. You aren't always going to feel great. It's not always going to be fun.
Okay.
It can be work, And I'm never going to like push somebody like a trainer to, I really want to follow the client's lead.
Okay.
But I always like to tell them, you kind of get out of it what you put into it. So if you're going to deal with hard stuff, it is going to be hard. It is going to be uncomfortable. Mm-hmm. It might be difficult to share those things like that we talked about, like you've never shared before. It's hard to come up with a word sometimes. Or to actually talk about it if you've never talked about it before. But I always tell people, therapists, we're used to it. You're not making us uncomfortable. We've heard a lot before, but just to be able for yourself, that can be hard. And so I kind of like to normalize that it's not just like, oh, this is so fun and easy and just like self-reflection, Mm-hmm. If your therapist isn't ever challenging you, then you might kind of wonder, is this helpful for me? If they're just patting you on the back, that might not be good.
Maybe you're not growing.
Yeah, maybe you're not growing. Maybe you're not being challenged. Mm-hmm. And sometimes I have to ask people, hey, did I push too hard? I try to be very like, okay, I'm going to say something that might be difficult, but I'm wondering this, and so it kind of allows people to reflect for themselves. Again, I'm not the expert. They know what's going on in their life. I'm just going to reflect back what I'm seeing. Also, therapists can't really give advice. I think sometimes people come, tell me what to do. Well, again, we're only with you 1 hour out of the week. You're living your life. We know there's things that you're not telling us just because there's not time to tell us all the things, so we can always help you reflect and think through and work through and process, but it still has to be that person, the patient, who makes that decision for what's next for them.
Absolutely. And they are living in that
They're
body.
living it, yeah. Mm-hmm.
Good. Any parting words, Dr. Nader?
I love what I do. I love my clients, patients. I love getting to see women's lives changed, It's just such a cool, and so I'm always just so grateful for people who come to my office and trust me with that, just mm-hmm. allowing me to go on the journey with them. Like mm-hmm. It's just such a cool experience, as we've talked about before, but it's fun. So it's fun to get to talk about it too. And I think it's fun because a lot of people wonder these kinds of things, and maybe people will have other questions, which I guess they could get sent to us about it. But yeah. I think it's helpful just to kind of normalize therapy and how important it is. So thank you for asking.
You are a gift. What you do is so important, and I know not only have you changed my life, but you have changed countless lives of my patients, and you're a gift to our community and to women in general.
Thanks.
So thanks for doing what you do.
Thank you.
For setting the captives free, so to speak, from whatever may be holding them back from a mental health standpoint. Mm-hmm. We hope you've enjoyed this episode of A Journey to Whole Woman Health. We've talked all about how to find that mental health provider that is just the right fit for you. Join us next time on this journey.
In this second episode, we want to highlight The Warm Place, which is an amazing nonprofit right here in Fort Worth, Texas, that helps grieving families find a place to really just process through their grief. It provides free groups for kids and their parents. And it's a place that I previously have volunteered, have worked, and it's just a place that's really warm to my heart, The Warm Place. So they have some of their fundraising events coming up. Check them out and go support them. Thank you for joining us on A Journey to Whole Woman Health. If this episode encouraged you, share it with a friend, leave a review, or subscribe so you don't miss future conversations. Remember, your questions matter, your health matters, and wholeness is a journey. Until next time.
Now for the legal language. This podcast is for educational and informational purposes only and is not intended as medical, mental health, or professional advice. The information shared on A Journey to Whole Woman Health is not a substitute for individualized care, diagnosis, or treatment from your own physician, mental health provider, or qualified healthcare professional. Always seek the advice of your personal healthcare provider regarding any medical or mental health concerns. Never disregard a delay seeking professional care because of something you heard in this podcast.